without further ado, I am excited to kick off day 2 of our conference, and this may be a little tall for me, with these next 2 speakers. Carol Cobe, to get her name right, is currently completing a PhD at the University of Missouri under the Translational Bioscience PhD program. Her emphasis is in population health and precision medicine. Her previous education includes a Bachelor of Science in Biology from Truman State University. Carol also works as a frontline staff member for the University of Missouri's National Institutes of Health All of Us Research Program branch. Her research interests include population-level data and neurological diseases. Carol is going to be co-presenting with Dr. Jane McElroy, a professor and epidemiologist in the Family and Community Medicine Department at the University of Missouri. Dr. McElroy is also the co-director of the Rural Health Research Center, and I think you can visit her in the exhibit hall when you get a chance. One element of the Rural Health Research Center is expanding the Missouri Practice-Based Innovations Network, which some of you may know as MOPIN, a clinic-based network for bidirectional engagement in research endeavors among rural healthcare clinics, systems, and researchers. Dr. McElroy's research focuses on quality improvement projects in partnership with federally qualified health centers, including improving immunization rates and colorectal cancer screenings. Besides cancer and viral exposures, Dr. McElroy is invested in reducing health disparities and has expertise in sexual and gender minorities among LGBTQ issues. Please join me in giving a warm welcome to Carol and Dr. McElroy. So here's your clicker, and you can use the podium mic or walk around.
Okay, thanks. Well, good morning, everyone. Wow, 8 a.m. and you're all here. This is impressive. Hope you had a good night, as you said, and thank you so much. Thank you for inviting us to present here. So we'd like to talk a little bit about COVID vaccinations and trust. And this was talked about a little bit yesterday, and we have a little slightly different story to tell. So maybe this will be a little provocative for you all. So this was a study, we're going to talk about, it's called the pandemic, and it was funded by a CDC, and it was a multi-state study. And you can see on the map all the different entities that were there. So when CDC funded that, University of Florida was the awardant. They received the prime award for the grant. And but they had a little they had to do something to get the award. And so what happened was CDC contacted Florida and said, we will only give you this award if you engage Lake of the Ozarks. And I'm not kidding. They said, so if you, seriously, and if you remember way back when COVID began, we hit national and international news at the lake for everybody partying down there and not taking care of themselves. So we ended up joining the pandemic grant because of the lake. So thank you, Lake of the Ozarks, for your wild party behaviors. So part of this grant is just to get shots in the arms, but it's also, the bigger part for us was, for the whole grant was actually, we didn't really understand the perceptions of COVID among the community members, and a big part was doing a survey of community members and encouraging people to get shots while we're at the event. So the idea was that if you're at community events and you just have conversations, and we heard a lot about that yesterday, about how do you talk to people, so have conversations at community events and have them fill out a survey about their perceptions. So we were at art festivals, and we were at a lot of local community events. We were at the Pride festivals, so lots of places around Missouri. So I just want to talk just briefly about like what our study was about. So the first, we're going to do this in 2 parts. So we, Linnell Phillips, who you heard spoke, asked some challenging questions yesterday to Linnell. So she actually had her students, her nursing students, do the survey. fairly early on when we were capturing data, and we looked at the results of that, and we were quite surprised by the results of what we found from the nursing students. And so then we expanded that, and we asked more students. So we had medical students, we had physician assistants, more nursing students, occupational and physical therapy students, and public health students, as well as then we compared those to community members and seeing what their perceptions were. And that was spurred by Linnell's having her students do the survey about their perceptions about COVID, about getting shots, future shots. Would you continue to get vaccinated, and demographics. This was the survey. So it's really, the thing when you're doing a survey at a community event, the whole point of that is it can't be too long, it can't be too complicated, and it can't be boring, right? Or you won't get people to finish it. And that's what our survey looked like. So we had paper copies because although people like Florida really want us to do electronic doesn't work all the time for people. And so we found paper is much more receptive to people when they want to do at an event, you're out having fun, give them a paper copy and they can flash through it. Okay, so I'm gonna let Carol take over and talk about the data for this one.
All right, so for this comparison of community members to health professionals, we had a total of 780 surveys completed. 516 of those were from our community members. Now, we did survey more than that many people. We had a couple thousand, but in order to not overwhelm our data set with those, we went ahead and stratified based on age, gender, and location, and then pulled out a random sample of those, and ended up with 516. We also had 74 medical students and physician assistants answer, 109 nursing students, 34 occupational physical therapists, and 47 of the public health students. So the first thing we asked them in this survey was, have you ever received a COVID vaccine? Now, we didn't ask them if they were fully vaccinated. We just asked at some point since the vaccines came out, did you have any doses? And this could have been the early on single shot Johnson & Johnson or the Moderna and Pfizer 2 shots, or later on bivalent forms. But we see here, to walk you through the graph, our groups are the community event participants, the first one, and then we have our medical students, our nursing students, the occupational and physical therapists, and then the public health students. And the green bars you're seeing are those that answered, yes, I have had a COVID vaccine at some point, and the blue are those that said that they have not. And what we notice here is that in all of our groups, both health professionals and in the community, that between 94 and 99% of people said that they did have a COVID vaccine. We didn't find a difference between the vaccination rates with them. So going from there, the next thing we wanted to know is, okay, in the future, would you get a COVID vaccine? And I'm sorry to engage you all at 8 in the morning, it's very early, but I did want to ask, what kind of response would you expect? Would you expect different percentages from what we're seeing here, people wanting to get vaccinated in the future? Do you think community members and health professionals might have different thoughts on that? If anyone wants to kind of raise their hand, shout out some ideas as to what kind of response we might have seen. Fewer, all right. Yeah, she said that we might expect to see fewer, so some people might say, I got the COVID vaccine and got COVID anyway, so I'm not going to get another vaccine. Any other ideas? Yeah. That's true. Some people might answer answers that they think we want to hear. That could have happened. That's true. Yeah, people might say, because of the side effects, I don't want to get any. Yeah. They were not made to get it in their schooling, no. Yeah. Yeah, that's true. So these surveys were done in 2022 and 2023, so, a bit after vaccines started coming out. We've had multiple boosters, so people might be tired of getting vaccines and not want to go get any more. Any other ideas, or are we ready for the reveal? Oh, I thought I saw a hand up. Oh, yeah, so she just said that some people might not like feeling forced to get another COVID vaccine.
So I just want to clarify, the medical students are required to get the vaccine. The nursing students, depending on what year they were, they know they're going to be required. MPH students were not, OPT not yet, but they know it's coming. And not, of course, not the community members, as far as we know. So it was a mixed bag, so I misspoke a little bit. No question. You have one more.
Oh, yeah. That's interesting. So if you didn't hear what she said that there were some businesses and places that said if you got the vaccine, you wouldn't have to wear a mask. So that might have driven some people to get vaccinated, which is interesting. I hadn't heard about that. But this is the results we saw when we asked them, do you plan to get a COVID vaccine in the future? So our green bars there are people that said no, they would not get a COVID vaccine in the future. The blue are those that said, yes, I would. And purple are people that said that they were unsure about it. And so what we're seeing here, interestingly, is that our nursing students had significantly fewer individuals that said that they would get vaccinated in the future compared to our community members. So you can see highlighted in the yellow bars there, our community members, how do we the text, 76% said, I think, that they would get vaccinated in the future, while in nursing we only saw 55%. And before I discuss this a little more, I just wanted to address real quick, if you're looking at those bars and have some questions, that you do see our public health students also said 55% would get the vaccine in the future, and our occupational and physical therapists only had 50%. Yet when we do the analysis, this isn't significant, and I just wanted to address that that is because possibly our low sample size. So I've reminded us above the bars there, the amount of people that we had in each health professional group. So our nursing, we had over 100. While in those other two groups, we had only 34 and 47. So potentially if we went out and surveyed some more students and they answered similarly, we might see some significance there. But that's why in an analysis, that's not popping up, even though you can see that less people wanted to vaccinate. But related, based on just the observational data, up there in the right corner, you're seeing the breakdown of essentially those green and purple bars, so people that said that they were not going to get vaccinated in the future or were unsure. And we're finding in all of our groups, at least 1/3 of people said that they are not interested in getting a vaccine in the future. And interestingly, we're actually seeing all of our health professional groups had less people that wanted to get vaccinated in the future compared to our community, which I think was kind of an unexpected result. So does anyone have any ideas maybe why this could be happening? Yeah, that's true. So she said that potentially people that are responding to the survey anyway and engaging in it would be interested in the vaccine anyway, which could be true. Yeah, that could be definitely. Our students are probably going to be younger than some people in the community that could have taken the survey, and that could be contributing to it. Yeah, that's definitely true. So some people might have, been forced to get it, and that could be contributing. Anyone else? Yeah, definitely, especially because these surveys were done in 2022, 2023, so that was a bit later.
Yeah, but health professionals are less likely? What the heck?
Yeah, definitely an interesting finding there. So, yeah. But moving on to some more questions that we asked and kind of how health professionals responded. Next, we gave the people taking the survey a list of viewpoints on vaccination and asked them, which one of these do you think best describes you? So the phrases were, I got vaccinated as soon as I could. I'm a person who waits to do something and wait and see what happens to others. And then we had two that for the purpose of analysis we've combined here, but they were separate, which were I don't trust the system and I'm skeptical about the COVID-19 pandemic. So what do you guys think we might have seen, especially based on results that we've had? Do you think, in one group we may see one response more than the other? Which do you think was most prevalent?
Okay, let's do this. Raise your hands if you think that the health professionals said, I'll get a vaccine. Raise your hand if you think the health professional said I would get the vaccine as soon as possible. I'm a person who will wait, health professionals. I'm skeptical, I don't believe in COVID. Okay, how about the community members? I'm gonna get it as soon as possible. I'll wait. And I don't trust the system, I'm skeptical. Yeah, so people are basically saying, I don't trust the system. The community, they're thinking kind of that less confident about the vaccine, that last bucket. Health professionals are kind of in the middle, I'll wait and see a bit when I'm looking at just the scanning the numbers, right? So we're seeing a difference, right? So we're looking at numbers, we're thinking there would be a difference between the two groups. Let's see what we see.
So here is what we saw. So the green bars are those that said, I got vaccinated as soon as I could. In blue, we have those that waited to see what happened to others. And then the purple were those two, I don't trust the system, or I'm skeptical about COVID-19. And so what we're finding here is that our occupational physical therapy students were actually less likely to say they would get vaccinated as soon as possible compared to our community event participants and other health professionals, which you can kind of see with the arrow there and the highlighting in yellow. And we find that they were more likely than other groups to say that they would wait and see what happened to others, which was definitely interesting. I don't know if that's the distribution we all really expected to see. So did anyone, I don't know, have any thoughts or ideas why that could be? If not, that's okay, but.
Puzzling, right? Why is OTPT, they're going to be, they're that second bucket, right? I'm going to wait and see. They're the different one. So, that's kind of weird. Like, why that group? Is it hands-on work, and something about hands-on work makes a difference, right? So the overall finding, you got an overall finding on this one, don't you? Didn't you do a summary on this one? Okay. So the overall finding on this one is that they're different, and I don't know about you, but I'm a little stunned that the health professions are not jumping on board and protecting their patients and protecting each other. They're going to wait and see. They're going to not get the next vaccine, maybe not. It may affect their careers, and so, of course, that's our job in education to kind of educate them up a bit about COVID. It was quite shocking, at least to me, that the community members were they were more willing to kind of jump in, and not the people who may actually, be working with sick people. Oh, you had this one, Risk.
Yeah, so then next we asked people to rate what they think their current personal risk of contracting COVID-19 is. We did this on a scale of 1 to 10, with 1 being, I don't think I'm going to get COVID, and 10 being, I do definitely think that I am going to get it. And so I guess we'll do another show of hands. Who thinks that the community members rated their risk of getting COVID low? Your hands? Okay, and who thinks that the community members rated their risk of getting COVID high, more on the 10 end? All right, and what about health professionals? Do you think they put their risk low? Show of hands.
Couple.
Yeah, and what about on the high end? How many of you think it's that? Okay, yeah. So.
Summarize that.
Yeah, so it seems like for both of them, people said that they thought, a lot of people would say they were at high risk, but that health professionals definitely would lean more that way than the community. And you guys are correct, that is kind of the trend we're seeing here. So the green bars are people that rated their risk pretty low, the 1 to 4 range. Blue is the middle, 5 to 7, and then purple, those that put it on the high end of an 8 to 10 personal risk level. And we are seeing here that the community members have a very different perception of what they think their risk might be compared to health professionals, specifically that they have lesser risk, which does logically, I think, make sense because health professionals are working with sick people, so it would make sense that you think your risk is higher. So, yeah, good job, everyone. Guessed it right. But the final question we asked was asking people who they trust most to give them information about COVID vaccines. And we had a lot of different options here, and I'll super quickly read them off for you. We had government agencies like the CDC and FDA, scientists and researchers, doctors or other healthcare professionals, family, friends. People could say they trusted nobody, only themselves, the news, religious leaders, coworkers, and then we had another category where they could write something in if none of those really fit. And for the purposes of analysis, we did combine a few of these groups, whether that be based on relevancy or kind of sample size or response rates. So we did go ahead and combine the CDC, FDA, and scientists and researchers category. We kept doctors and healthcare professionals separate, though. We combined family and friends. We kept the nobody category on its own. And then these ones at the bottom here, news, religious leaders, coworkers, and other, we went ahead and combined because we actually got a pretty low response on both of those, which you'll see in a moment, which was kind of interesting. I think we thought more people might say the news or religious leaders. But does anyone have any thoughts on, do you think health professionals are going to trust the CDC and scientists the most? Anyone think that? Do you think maybe they'll trust doctors more? Family and friends, maybe? Nobody? Or any of those other categories? No. Okay, what about the community? Do we think that they're going to trust the CDC and scientists most? Hands? Doctors and health professionals most? Family and friends, maybe? Do you think the community members will say they trust nobody? And then the other categories. Yeah, so we're expecting kind of a little bit of a difference between the two. So what we find here, I'm going to really try to explain these colors well. So in the aqua-ish color, the big bars, we have the CDC and scientists. They said they trusted them most. Then above that, in the darker of the blues, are doctors and healthcare providers. Then family and friends are in purple. The lighter blue are those that said they trusted nobody. And then green was that other category. And so interestingly, what we're seeing here, medical students trust the CDC and or scientists significantly more than the community, which you can kind of see with the arrow there. I think is that 82? 82% of medical students said that that was their most trusted source for vaccination, while in the community we're seeing much lower. And we're actually seeing in medical students compared to all health professionals, they trusted the CDC and scientists more. And then, kind of funnily, I would say, we saw that medical students trusted doctors significantly less than all the other groups. Yeah, you can see with that arrow there, I think 15% of them said that that's who they trusted, and we're not seeing that in the other groups. In fact,
So are you terrified now?
Yeah, definitely interesting. And we're also seeing, oh.
So they were asked, who do you trust most? But it's a paper copy, and so people didn't follow the directions, so they checked all if they wanted to. So we had a hybrid.
Yeah, we did tell them to select one, but.
Although with the health professionals, that was an online, and so they only got one. So this particular survey, that was not paper, it was electronic with the students, and they could only choose one.
Yeah, we're seeing a difference, especially even other healthcare professionals that are not medical students. We're seeing they still have pretty high trust in doctors and other healthcare professionals. So it's specifically medical students we're seeing this trend, which is kind of interesting.
So the thing that's also kind of may not be completely obvious is that when we looked at this, we're saying compared to community members, this is the only time that we had something in all other groups. So doctors trusted themselves, and hopefully not themselves, but the other doctors, than all other groups, right? So they're the ones that really stood out as being very, very different about who they trusted.
Yeah, so before we look a little more into the vaccine hesitancy and more into kind of the trends of trust, just a quick little summary of what we just looked at. So we do find that there are differing opinions between about the COVID-19 pandemic between our community members and our healthcare professionals, which I think is kind of what a lot of us expected. We're seeing some difference in the trusted source of information. We're seeing health professionals tend to trust the CDC and scientists a lot more. And we're also seeing that the community members definitely think they're at less of a risk for infecting or getting infected with COVID. But we're also seeing differing opinions among our healthcare professional groups. They're not exactly a homogenous group. They don't all have the same thoughts about COVID. So just a reminder, some of those were that nursing students, significantly less of them said that they plan to get a COVID vaccine in the future. Our occupational and physical therapists said that they were more likely to wait and see what happened to others before getting a vaccine. And we just saw with the medical students that a lot less of them had trust in doctors about vaccine information. But with that, I'm going to hand it off to you.
So we had a lot on hesitancy. So if you downloaded the PDF earlier, we're switching up our presentation because we heard great presentations yesterday in hesitancy, and we were kind of saying the same thing, and I thought that would be boring. So we changed this up a little bit and talk about another piece of this project, which is looking at trajectory of trust over time. So just to remind, I have a little cheat sheet on my desk to remind me of when everything happened, because I swear to God, things blurred. Was it 2021? And so for me, when did things happen? And so, and you're doing a community event, you're asking people, when did you get your shot? I don't know if I could answer that myself without getting a cheat sheet to go, oh yeah, it was then. So we had people saying they got their shot before the vaccine even happened, on the survey, because they got the year wrong, right? Or, or they just didn't know, or they sort of guessed. And that's part of the issue when you do a survey with community members. You don't always get exactly precise information. But this is just a reminder of when the shots happened for all of us. And I just wanted to just do a quick reminder where we're at on our trends. This is just number of doses by state, and we're not at the bottom, which is fantastic. A lot of times when I do surveillance studies in Missouri, we often are not doing so well. We're not at the bottom, which is good, and we're not nearly at the top, but we're sort of low-ish part of the 50 states on where we're at on dosage for COVID. And for those of you who went to the National Immunization Coalition conference in Philly a couple weeks ago, this is one of the things I gleaned from it that I just want to share with you. And this is again with Dr. Offit. He was on a plenary, which was fantastic, and he was talking. I was scribbling notes, and then this sort of, I thought, put things together really well for me about why do we have hesitancy? Like, why are people so hesitant? What's it all about? And I think there's some real validity to why people are a little hesitant. I just want to go over sort of some key points that didn't help people be confident. And the first thing was, it was the fact, as we all know, it was the fastest vaccine that was developed. What people don't seem to know is that, so we isolated the vaccine in December, and then 11 months later we had the vaccine, which is crazy fast for people in their minds. But what a lot of people don't seem to get is that the risk of doing that was taken away from the companies, and the government spent $3 million on that to be able to take that risk away. Or $11 billion, not 3 million, $11 billion to take that risk away, right? The other thing that people don't sometimes know is whenever you do a vaccine, you kind of throw it out there, and then you wait for about 3 million doses before there's a sigh of relief that there's not a population-based effect that you can find in clinical trials. It's just a numbers game, right? Well, and there was a bit. So they put the vaccine out, and we saw some J&J thing there in and out and all that stuff, right? So that was about the 3 million doses. Well, at this point, we have 13 billion doses of COVID, so I think we're okay for safety. And that's something that, when people say I'm concerned about safety, it's like, yeah, you're right, you're absolutely right. Up until we get that 3 million dose or so, you should think about safety. And we've got some egregious stories about things coming out and drugs being produced and people taking them and horrible things happening. So that's a valid excuse or valid reasoning, but now we can say, well, it's 13 billion doses and we're still okay. I think we'll be okay. There's also this sort of yin and yang thing that was happening with the FDA authorization. So they did this anti-malarial drug and they approved it. And then 2 months later, they pulled it because they saw no effect. And then as a general public person, I'm like, well, the FDA said it was safe, and now they're saying it's not safe. Can I possibly believe the FDA? Is that yin and yang really kind of disrupted people's confidence? And then also at the same time, Trump was also, the former President Trump was also advocating taking this anti-malarial. So our leader of our country was also supporting something that we found was not effective. Another piece that happened was in July of 2021, I was going to say 2011, 2021, there was a big surge, like 3/4 of the people who got COVID were vaccinated. And they're, what the heck? I got vaccinated and I still got COVID. So Dr. Offit talks about the misconception that people think about immunization equals immortality, right? He uses that phrase, which I really like. And so a lot of people thought, oh, I get the shot, I should not get sick. They just didn't realize that it wasn't about not getting sick, it was about not getting very sick or dying. And because of a lot of the vaccine, because we call it a vaccine now, we think we're protected from getting the disease. Because we have other stories like, oh, if your child gets polio, the polio vaccine, then you're going to prevent them from getting polio. which is sort of a, sort of true, not true kind of thing. And so the idea is that we probably need to just change the word and call it COVID shot, like the flu shot, because people know you can get the flu shot, you can still get the flu, but you won't be as sick. We probably need to change the language and call it just the COVID shot now, so they don't misunderstand that. Then we have very inconsistent messaging by the government. So Biden authorized the bivalent dose for those 12 years and older, and that in August of 2022, and that was not supported by the CDC. He just did that, right? And then the vaccine was authorized for 6 and older in December of 2022, and at that time, it was again that one was not supported by the FDA at that time, and there's no other country in the world that's doing that young of an age for 6 and up. And so again, people are going inconsistency right between the different entities. And then we talked about this yesterday about we've forgotten what it's like to have little ones sick and die from these diseases that we can prevent. So there's just this whole cohort of people who've just forgotten that reality. And the final thing is that sort of we're learning as we go, and we got changing messages. So the bivalent dose came out, and we're like, oh, that's going to happen one half of the other. It's going to be great. That was a big hoopla to do that. But we found out it's no different than a single dose. So now we've gone back to single dose. So first we're at a bivalent, and now we're at a single. And so that's sort of learning as they go. I think the public is less confident when they may feel like they're a bit more like guinea pigs. Like, do we really know what's going on? And so I thought those were a really well-crafted way of why is there hesitancy? I think there's valid reasons for it, quite frankly. Very valid reasons, but we have kind of counter arguments to those now. We have some data that's helpful. So I want to talk now a little bit about the trajectory of the trusted sources for COVID. And just again, this is an anonymous cross-sectional survey. You saw this survey earlier in the presentation. 44 items. We asked about demographics. We asked about COVID, perceptions, their history, and trusted sources. And this one here, so we have data from January 2022 all the way through December 2023. So how do you analyze that data? And we have data for every month. So we broke it into 3 time frames to look at the data. And so we looked at it sort of like when the vax and the boosters were available, and then we looked at it when the bivalent became available and forward, and then when the pandemic ended. And that was thinking about just history, like would these things make an impact on what people said? And it was just sort of sitting around the table kind of deciding that. Other than that, there was no reason that we broke it that way. So here's the pink, light purple colored counties. These are all the counties that we actually had respondents for our survey. So we have fairly decent coverage. It's over 6,000 surveys that we collected. We had, for those of you who know, we had the extension, MU extension. We had like 10 extension faculty members collecting data from their community members. And then of course we had over 100 events that we were at collecting data. So fairly decent coverage of Missourians. And you can kind of see that at this event, we're a bit on the younger side. So 60-some% were young, under 50. So again, people going to community events is a bit younger population. It kind of represents, it's a little on the white side. Our Missouri population is about 13% Black. We're at 7 here. So a bit on the white side for the respondents. And then because we were at Pride festivals, we had about almost a little over a quarter of the participants were of sexual and gender minority, also known LGBTQ plus population. 31% obviously were rural. You can kind of see that by just the map. And then 78% were vaccinated. So unlike the health professionals, we had over 90% vaccinated. In this case, we had 78 were vaccinated. And again, that's a little work in progress, right? Because I've talked to people and I ask them, are you up to date on vaccines? And they got the bivalent and they'll tell me today they're up to date. So there's that misunderstanding about, do I understand what that means? But we were just asking, have you ever had a vaccine? And they said, yes, we call them vaccinated. And again, just to remind you, that's how we broke it down about trust. And so what we found was that you're not surprised, I'm sure, health professionals were considered a trusted source, but so was CDC. And so those, throughout all 3 time periods, that was considered the most trusted source. That did not change. But what did change is over time was that CDC became more trusted. And a six-fold increase in trust over time between the first and the last time period. So they had a trajectory that was going up, whereas the clinicians, they actually went down from the first to the last period, but again, something goes up, something has to go down. So they're still very well trusted, but they weren't an upward trajectory. They kind of stayed a little on the downward trend. What was also fascinating to us over this time period, nobody, I don't trust anybody, that stayed stable. There was no movement on that. So people, again, this is cross-sectional, so we're not asking the same person over time. So these are different people, but we're having the same proportion of people who are saying, I don't really trust anybody. I do my own research, I make my own decisions, I don't trust anybody. That's about 8% of the population, of our survey population of Missourians who are saying, I don't trust anybody. And so that is a little worrisome to us, and that may be the ones who, they may or may not get the shot, but not everybody who says, I don't trust anyone is unvaccinated, right? Many are, but they don't trust any other sources. And that could be due to our language, our way that we are communicating with our messaging, and we had some interesting commentaries about some physicians who are saying stuff that may not be evidence-based. And so they're having some mismessaging from the different systems. And even with the CDC and government, there's been a bit of different messaging, but maybe what we're seeing is there's been more consistency over time. Anyone have any thoughts on this that they would like to share first thing in the morning? Okay, that's good. We'll move on. So the next thing was that talking about vaccinated. So people who are vaccinated, looking at these by groups, people who are vaccinated were more likely to trust CDC and doctors. Okay, so again, this is I think this is a mantra we've been hearing at the conference about doctors being trusted sources. But I think a new piece of information is that CDC has actually kind of gotten their mojo back a little bit for being a trusted source. I think they worked really hard at that to try to give a consistent messaging. And so I think they're doing a better job, or at least the public is feeling they're getting a better job from the CDC. And that's reassuring. So for those of you who use resources, maybe having it branded with CDC branding may not actually be negative. I think early on that might not have been a good thing. But maybe now that may not be such a bad thing if it was branded with CDC information. And then, of course, not surprising, people, if they're trusting health professionals and they're trusting CDC, then they're going to be, it ended up being statistically significantly less likely to trust friends and family. So they're relying on less external sources. When we look at LGBTQ, the sexual and gender minority population, they were more likely to trust CDC, and they live in an urban, and more likely to live in an urban area. And they were less likely to trust doctors. And again, for me, in my world, in this research world, that's not surprising. There's been a lot of egregious behavior that's happened for LGBT community when they go to physicians. So I think they don't have as much trust in the doctors in general. So to me, that wasn't a very surprising finding. And but the one that I found, again, I don't quite get this one. People who live in urban areas are less likely to trust doctors. That again, why is that? Why would they be less likely if they live in an urban area? That one's a little puzzling to me. And the only possibility I can think of is that our data is skewed, that we have quite a high number of SGM, and SGM are more likely to live in urban areas. And so maybe it's skewing the data. We didn't adjust for that, in a model for SGM. And so maybe it's that they live in urban areas. But anybody have any insight they can share with me about? That's a puzzling one to me. Why would urban people be less? Yeah. Okay, she's brilliant. So, so living in a rural area, you have more connections with people, and you have more connections with the physicians, so you're more likely to trust somebody that you know because you have a connection. Anyone else have a thought? I'll go here.
So lots of urban areas, specific census tracts have a higher population of African American, Hispanic, Latinx community members, and they definitely don't have as much trust as white populations in medical professionals because of historical context. And some of those urban people, even though they seem to be living in a city which you think would have more trusted doctors, they're actually living in poor areas, there's less education, and they have this historical mistrust. And that might be giving you some of that.
Okay, so he said you can have more ethnic and racial minorities living in urban areas, which is true, and that in this study also, and that they may, and also not that you're ethnic or gender minority and that you're poor, but that you may have more people who are ethnic and gender minority who are poor living in those areas, and because of historical, which we heard yesterday, the Tuskegee, and we've heard other reasons, that there may be ethnic and gender minority populations who distrust the medical system because of that historical information. Good, very good point. And that, there's somebody, yes.
So in a rural area, you're more likely to only have one voice of opinion when it comes to a healthcare professional. In a more urban area, you're more likely to have heard differing opinions from different healthcare professionals. So I think that breaks down the trust of the group.
Okay, so I think you guys need to join my research team. So his point was that if you live in a rural area, you're likely to have one voice and you'll have one opinion. And so you don't have, in an urban area, you have multiple voices that can contradict each other. And therefore, it's more confusing. Or you're like, well, who do I trust when I have A saying one thing and B saying another thing? Whereas in the rural area, you have more consistency in the messaging. Again. Right. Good points. Okay, thank you. I was like, what the heck? Why is that happening? Love it. Okay. And then, okay, so the take-home message. So, I think we've heard this again. I feel like we've heard this a lot here, but just trying to understand people's perspectives, untrusted source is really important. And then as clinicians and working with patients, understanding that there may be, they may have different levels of comfort, they may have different levels of trust, but that we have this, that we have to understand that of our patients. And we heard that a lot yesterday. I think also understanding that, to me, the kind of little sigh of relief to some extent is that we're having CDC and the government's resources that we can use. We can have those be something that maybe we can use for our community members. Do you want to do the resource page? So I'm just going to flash through the resource page, and it'll be in your printouts if you want those later. We just put these on here for interest. And these are just different resources, and again, they're part of your packet in case you're interested. And again, these are CDC. So we have different opinions. Has anything shaped what people do? CDC is doing a better job. And trustworthy with various, including with medical people. Thank you.
Thank you both for presenting a very interesting research. I know that you guys have been working on this project for a long time, and so congratulations on putting this all together to present for us. We're so glad that you were here. I actually participated in taking one of the surveys at a local Columbia outreach event, so I'm really excited to see the findings and the data coming out of your work. Incredible job. Let's open it up to some questions. First thing in the morning, you guys have been great participating already, but any questions for our presenters?
I see you, Dr. Holler.
Okay, well, I'll let you head that way, and then I'm coming this way for you next. How's that?
Thank you. Is this on? Okay. Thank you for the fifth time. Yeah, a wonderful presentation, and thank you for all this work. And certainly, I would agree that, that the data you've gathered is remarkably current. And I think that you're right about the increasing confidence in the general public in CDC and government agencies as things have settled down and we have more data and we can say definitely this is going on. Again, I do have a little bit of just a question about the most trusted source thing, because you talk about medical students having you say the most trusted source is researchers, CDC, primary sources, and doctors less. I don't think that means that they trust doctors less. I think it's just that we train them to go to primary sources. You know, their professors, the doctors, the people they work with are a secondary source. So I think the conclusion that they don't trust doctors is not I think it has to be more nuanced than that. That, you know, part of the training is you do you look for the evidence, you look at the studies. We will help you interpret it, but that's what you need to do. And I think that's borne out in your data. So I wouldn't say that medical students and public health students don't trust doctors. It's just that we have trained them to go to the source, and then we are there for backup.
Okay, I can be less terrified now.
Okay.
No, I think that's a really good point. I think that's a very, very good point. And teaching at the medical school, I completely agree with you that we do push them to primary sources, and we trust them to up to date, you know, which has got all the new stuff, and then that's what they're trained to do. So I totally agree with you, and I think that that's probably a better interpretation of it. And that actually, honestly, that relieves me a little bit. I was a little terrified when I saw that result. So thank you.
One more question here.
Ashley Campbell from Fels-Myers County, Rolla. More of an observation to one of the survey questions about healthcare providers wanting to wait to be vaccinated for view of what's going to happen to others. We saw the same trend in our area, but for different reasons. Most of our healthcare providers, especially early on, did opt to wait. But the reasons that we heard were more of due to the nature of my job, I've already had COVID, so I have some immunity. Or due to the nature of my job, I have proper PPE, so please save the very limited vaccines for others at risk. And many would even go as far as giving us groups of people that they felt were more at risk than themselves, funeral home directors, first responders. So I kind of found that interesting that the only option was because they wanted to wait and see what happened to others, whereas what we encountered more was they wanted to wait and see because they didn't view themselves as high risk as others. So I'm just curious if anyone else kind of saw that, or if your surveys kind of captured any of that.
Can I just get a raise of hands? Did anyone else see that just so you can see that it was out there too? Yeah. So we had this survey from 2022 to 2023, and so the limited resources probably wasn't as influential. But that sort of thing, it was OT, PT were the ones that were less the wait and see people. And so it could be very much that they're feeling fully covered. We did not ask that, and that's why in research, when you do these survey questions, you don't understand, the why is hard. If you ask people why on a community survey, they're never gonna fill it out for you. But then you follow up with a qualitative study. So both comments that were made here, I think would behoove us to follow up and find out the whys for some of these. Because I think that's equally important. And I think that's a really good point about, the medical profession wanting to wait and see. I think we also heard yesterday about people just saying, I'm not gonna do it. I'm gonna lose my job. I'm gonna walk away from this job because I won't get vaccinated. So we have both groups in there also. Excellent point, though. Excellent point.
Other questions? Going once, going,
Ken has
one
one.
more
Coming
from
back to
Dr.
you,
Holler.
Let's talk again.
Well, you gave me permission. So the other thing, because I think that question about healthcare providers maybe having less confidence in the vaccine at certain points, I think that kind of makes sense too. One of the things I talked about was being on stage and backstage. Mm-hmm. And we talk to the general public, we're generally on stage. So we're generally speaking with confidence and with assurance and things like that. Whereas behind the scenes, we're going, there's so much stuff going on with these vaccines, and and so people in our group can see that there might be concerns, and the things that you don't say to the public, you might say to your colleagues and to other people. So I wonder if that may be part of this also, just the conversations that people are having that we don't necessarily have with the public, and that might be coloring some of those responses.
Yeah, doctors are people too. Thank you so much for this presentation, and thank you so much for participating. You've actually made me think and made our research better, so I really appreciate you sharing your ideas because it's super helpful. Thank you so much.
Another round of applause. Thank you.